gone, right? So there's always some amount of maintenance and work that you have to do to be able to work through whatever the diagnosis is. Okay. So I like to say lifetime prevalence, not to be intimidating, but to empower and say, it's okay. We just have to navigate the path one step at a time and remember our tools that you've learned that work for you. Or if you don't have tools, or the tools that you have need to be reinforced or reinvented in some way, then let's do that. But just take it one step at a time, and don't put the pressure on yourself of like, I have to be cured. Like that's not going to help either with the pressure. So just take it one step at a time. And yeah, there is what I would argue to be a lifetime prevalence, just because we have to do that ongoing work and maintenance.
I see. All right. So, Dr. Mal, what do you say about mushrooms? What I mean by that, I saw on Instagram, so it's definitely real. It's 100% real. I saw that there's some mushroom therapies out there that can cure PTSD and depression. I don't know how much of this is true. I don't know how much of this has been studied. And have you heard anything about that? Yeah.
Yeah. I mean, it's a big thing. It's growing now.
Mhm.
Like the world of psychedelics is something that has really gained a lot of traction and a lot of interest. There's definite momentum both in scientific research and in public interest. And there's a lot of studies now that show how promising results can be in using substances like psilocybin or ketamine, even mushrooms, what have you. And what I always say is that these treatments are still being studied and regulated, right? They're definitely beginning to transform our understanding of alternative treatment approaches and even understanding the diagnoses that they're being used to treat. But we want to be careful, okay? There's a lot of evidence that needs to be built into it. And just like any other therapeutic modality, it might not be for everybody. So just be very, very careful. Just like traditional therapies like CBT that I mentioned earlier, EMDR, they've helped many people. Not everyone responds to those methods. So we have to consider the person holistically. And when it comes to something like complex trauma, psychedelics can definitely offer a new therapeutic avenue by opening up different pathways in the brain, and under guided conditions allow them to access and process traumatic memories in a very safe and supportive setting. So it can definitely help and work. And what you're talking about, so mushrooms, psilocybin, it's showing potential, and particularly for treatment resistant depression and anxiety, which often co occur with PTSD. And a lot of the research is suggesting that psilocybin can help individuals with that reframing, restructuring of experiences to help them with gaining a new perspective, which can be particularly helpful for people who are feeling stuck in trauma. You know, I think what's really interesting about psychedelics like psilocybin is that they tend to create a sense of interconnectedness and emotional openness that can foster healing in a way that sometimes some people cannot establish well in traditional talk therapy, whether it's for their own limitations or maybe because they haven't found the right therapist, whatever. But just as I say that, it's really, really important to note that it is not a one size fits all solution. And it's not just about the substance, it's about the process, the therapeutic.
Okay, we're back, but we lost Dr. Mala. Let's try to bring her back. Hi, Dr. Mala. We lost connection. I'm sorry. Give me 1 second. I think we're back. So,
Okay.
we were talking about how it's not a size fit all mushrooms.
Right. It's not a one size fits all solution. And it's not just about the substance, it's about the process, right? So you want to take into consideration things like the therapeutic setting, the trained guides who facilitate the sessions. And one of my sayings is the set and the setting are crucial. The experience has got to take place in a controlled, safe environment with trained professionals who can guide individuals through the process and help them integrate the experience. That's key afterwards, after the treatment's actually done. So be very careful, make sure you're getting the proper professional support as you do it. This isn't something that I would ever recommend without trained support and reputable people taking you through that.
I see. So did any of your patients went through this process?
Not with the military. No. Now I do and have had individuals that I've worked with outside of the military who have explored the same and even post-service, and I've seen mixed results.
I see.
So some people love it, and think it's great. I've seen people who have gone through it and then been great for a moment and then afterwards don't do well. And then I've seen people who they're like, it did absolutely nothing for me. It was just,
Really?
yeah. Yeah. So I've seen a full smattering of results.
I
Yeah.
see. That's extremely interesting because I mean, it sounds like just a new tool. It's just like a new drug that can help people, not necessarily will, but can help. And I mean, if you're on one of those people that have not cured from PTSD yet and are looking for new avenues and feeling experimental, maybe that's something
Yeah.
you could try, and maybe it will help you. So that's very exciting for those individuals.
Yeah, I know
Yeah.
for sure. And, again, if you can do something that works for you, that's done in a safe and appropriate way, then I'm not going to stand in your way, but the thing that is really important to know is that you don't want to start a new habit that can potentially be habit forming, right? Or have additional issues get drummed up because now you're replacing one thing with another, right? So there's a lot. Again, I'm very, very cautionary when it comes to this. Yes, it can help. I've seen it help a lot of people in an appropriate and good way, and it is a possibility, but you have to do it properly, and it's not for everybody. Yeah.
That's very important. So that's another topic that you also cover. That's something that you help people with as well, right? Combating addiction or the
Yes.
stigma of addiction. So how
Mhm.
would you describe the stigma of addiction?
Oh gosh, I mean, like any other how much time do you have for that? The stigma of addiction, gosh, the biggest thing is, I think the if you are an addict, right, people think, or society has thought, that you are lesser than. People feel lesser than because they're worthy. Again, there's that sense of, self-esteem and of course doubt that goes along with that. So the biggest thing is there's a lack of understanding what addiction's about. Whenever there's a stigma, it's usually that stigma exists because people don't fully understand or educate themselves to what it's really about. And there's a lot of different models for addiction, which